9 common causes of knee pain and types of treatment.
Do you suffer from knee pain?
Your knee pain could be caused by the following 9 types of knee conditions that I commonly treat.
Number 1. A quadriceps muscle strain. The quadriceps are made up of 4 muscles at the front of the thigh, which straighten the knee when they contract.
There are 3 different levels of muscle strain or tear. Grade 1. A fully functioning injury where a small number of muscle fibres are torn, resulting in some pain.
Grade 2. A moderate loss of function occurs as a significant number of muscle fibres are torn.
Grade 3. All muscle fibres are ruptured, resulting in a major loss of function.
Number 2. A meniscal tear. This is characterised by the knee constantly clicking and giving way at times.
Number 3. Knee osteoarthritis. Osteo is the Greek word meaning bone, arth meaning joint, and itis meaning inflammation.
So literally an inflamed bone joint.
There are various stages of bone osteoarthritis, each with different characteristics.
Although the knee doesn't start to cause pain until the late stages of degeneration and the inability to extend the knee at all.
Number 4. Iliotibial band friction syndrome, ITB syndrome. The ITB band runs along the outside of the thigh and connects to the outside of the knee.
Sometimes this tough band of connective tissue can rub on the bone on the outside of the knee and cause inflammation.
This is a common condition endurance runners can suffer from.
Number 5. Chondromalacia patella, commonly known as runner's knee. The kneecap and the underlying femur has wear and tear, and where the cartilage has worn away, it is aggravated by the repetitive impact of running, hence the more common term runner's knee.
Number 6. Bursitis. A bursa is a fluid-filled sac. They help to absorb shock. They also help to prevent friction.
But when inflamed, they swell up, usually after a trauma or repetitive activity such as running.
The pain is very specifically located in one place and is usually very tender to touch.
Number 7. Osgood-Schlatter disease. This is a condition that affects active teenagers.
It is where the periosteum, which is the outer shell of the bone at the front of the shin bone, becomes irritated due to the thigh muscle constantly pulling on it.
Over time, the periosteum starts to develop extra bone, and in some serious cases, a bit of the bone gets pulled away from the shin bone, resulting in an avulsion fracture.
Number 8. Baker's cyst. This is typically post-traumatic and is an injury characterised by a bump at the back of the knee.
This can be sharp and painful if it irritates a nerve in a nearby muscle.
Number 9. Knee joint swelling, commonly referred to as having water on the knee.
The knee swells up and becomes painful due to the body responding to some form of damage by inflaming.
The knee is a joint commonly affected by joint effusion.
There is treatment offered by Joint Healthcare, which is all backed by research. This includes fascial manipulation, deep tissue massage, a rehab program, and traction treatment.
Adam from Joint Healthcare has helped the following people with their knee injuries.
Jessie says,
Adam went through various movements with me to diagnose my knee pain. With this knowledge, I'm able to correct the problem without having to go back time and time again. Very good at what he does. Thank you.
And Maxine says, following the slow and eventual recovery of a knee injury which had included support and advice from various healthcare professionals, I was unable to walk normally. After an assessment by Adam, he identified a shortening of my calf muscle as a direct result of my long healing process. Through a number of sessions of physical manipulation of my relevant muscles and a program of targeted exercises, I am now able to walk again without discomfort, and I've even recently been able to enjoy a 7-mile walk. I am so very grateful for the action of Adam, without which the damage to the muscle might have been irreversible.